Hi, this is a quick run through what you might expect for emergency eye and breathing problems while this coronavirus pandemic and the restrictions going on. So eye problems, eyes generally, you've only got two of them, you need to look after them, and they can go downhill really quickly once they start. Horses are prone to various problems: ulcers, trauma, getting them stuck in fences or thorns, uveitis, ulcers. You can get nasty ones like melting ulcers, and you can also get eyelid wounds like below. So this will be a melting ulcer. It looks like ice cream on your horse's eye, and this is an eyelid laceration. So signs that your horse has got a sore eye: the eye is tightly closed, there's something running from it, that can be clear or pussy. In these circumstances, you really need to let your vet know exactly what you can see. It may just be that the eye is really tight shut and you can't actually see anything, but that is important information in itself, so please do let us know that. Whether there's any swelling or any wounds you could see, or whether the eye looks cloudy. You can see this one looks a little bit cloudy in there, or like it's got a lump of vanilla ice cream about to drop off it. If your horse has any history of eye problems, again, let your vet know. And eyes obviously on the head, so it's going to be difficult to maintain social distancing. So you're going to need to have a good think about you and your vet about how you're going to do this if you need an examination. It may be that your vet can examine this eye, if it's not too bad, using a video call or a FaceTime or something like that. But it may well be, if they're worse, that you need some form of visit. So ideally we need a stable. It's always good to have somewhere dark, or the option to have somewhere dark if you need to examine an eye. Again, you need to follow your vet's advice on how they're going to do this. Ideally, we would have the owner out of the stable or away, and we'd be able to sedate the horse and block the eye so that we can look carefully, we can provide treatment for your horse, but we're not getting too close to each other. Obviously, if you are ill, or any of your household are ill or on self-isolation, you will not be able to be there. You will have to ask a friend to be with the horse and work with the vet to ensure that the vet and their staff and their families and yourself all stay as healthy as possible. In that situation, you'll need to liaise with the vet or your friend via the phone. So eyes that are swollen shut are painful, they're not normal, and you do need to talk to someone about it. You may well need a visit, but you should at least ring, talk to your vet, maybe do a video call or a WhatsApp call, just to let them see what's going on. Keeping as few people as possible are obviously very important, and don't give bute unless you've spoken to your vet. It's really important that we know exactly how painful that eye is when we're talking to you, or if we're doing a video call, when we do that video call. So moving on to breathing problems. It's unusual for a horse that's never had breathing problems before to suddenly develop them acutely, but if you do have a horse that has a history of them, be aware that they may flare up. You can get them in previously normal horses. They can be infectious, or they can be due to allergies. So signs of breathing problems would be that your horse's breathing rate, or respiratory rate as we would call it, has gone up. It should be about 12 breaths per minute. In this horse, you can see his nostrils are really flared wide open, and you can expect that he would have his sides coming up and down to try and move the air in and out of his lungs. There may be some respiratory noise, or there may not be. He may or may not have cough, and they may or may not be off their food. These are all things that you need to let your vet know about. Check your horse's temperature. That's a really important thing for you to do for us, so that we can advise you better via video call. We can prescribe by video call. Our licensing has changed during this pandemic. Temperature should be about 37.5 degrees C or 99 degrees Fahrenheit. A degree above or below that, given temperature or whether it's a hot day, is not too bad. But if we're getting up to sort of 39 degrees, then we really need to know about that. If these signs have come in on your horse when you've just put your horse in a stable, or it's been in a stable for a couple of hours, take it away from the stable, away from any dust or allergens that might be in that stable. And similarly, if you've just turned your horse out, or it's been out for a couple of hours and it's started coughing or wheezing or having trouble breathing, then bring him in. So you're moving them from any potential allergens. Oilseed rape is quite bad just at the moment. If it's a hot day, take your horse's rug off and ideally try and stand them in some shade and keep them as quiet as they can. This may involve having one of their friends nearby or removing other horses. Have a look around the rest of the yard, find out if anybody else's horses are affected. If other horses are affected, it may be more likely to be an infectious thing. Similarly, if your horse has a high temperature, it's more likely to be infectious, though they can get a slight increase with temperature just with distress if they're breathing very fast. And of course, call your vet, discuss all these things, and you can make an informed decision, and your vet can make an informed decision about whether or not they need to attend and see your horse, or whether they can prescribe drugs via a video call. So take-home message, taking temperatures is really important if you can safely. And if your horse's respiratory rate is consistently over 30 breaths per minute, you do need to call your vet as an emergency. Keep your horse calm and quiet if you can, and as always, take your vet's advice on how to proceed with this examination. It is more tricky in these times, but we do want to work with you to try and look after your horses. It's just that every case needs to be examined and treated and managed in a different way, possibly in a slightly different way. There are no set rules on what and how you manage each emergency.